These are just some common personal injury symptoms and therapies. A lot of time I'm asked, what therapies you do and when do you do them and why do you do them and things like that. So I just wanted to put together, these are some of the common symptoms and therapies you do. Remember, your whole treatment protocol is based on two key factors. Number one, what are your biomarkers? Your biomarkers are your tests. They're your subjective findings. They're your hybrid subjective and objective and totally objective. Relative to the phase of healing that you're in. That is what now there's incidental stuff, in addition to that, do they have diabetes? Are they older? Are they younger? There's limiting factors and all that kind of stuff. Do they exercise? Do they follow directions? So there's a lot of peripheral stuff, but the absolute core of your treatment recommendation is your therapeutic, your biomarkers relative to your 3 phases of healing, period. That's it. That's the core of why you do what you do, and you need to be able to explain it that way. It's all science-based. It's not your opinion. So common personal injury symptoms and therapies. So therapies for each of the 3 phases of healing. This is why you should be doing your therapies. Your therapies for inflammation phase, therapies for repair phase, therapies for remodel phase. I'll just tell you, I'm going to give you a very generic statement right now of why you should be doing therapies. Well, the first and the third are easy. What kind of therapies should you be doing for the pain and inflammation phase? Pain and inflammation therapies. Anti-pain and okay, right? So that's the first phase. The second phase, and the third phase easy. The third phase is easy. What's the remodel phase? The remodel phase is your therapies are to increase strength and elasticity. That's the remodel phase. Your repair phase, your therapies are to increase active and passive range of motion. Active, passive, and joint motion. That's what your therapies are. Now these are generic. These are just very good generic ways of thinking about the 3 phases of healing. So my therapies in the inflammatory phase are going to be decreased pain, inflammation, and typically muscle spasms. In the repair phase, it's typically going to be that, whatever exists in that category that still exists, plus now I'm going to start moving them into, as I can, into the active, passive, and joint motion therapies for the collagen and the neural effects. Then, as they move into the remodel phase, my therapies are going to shift over into the strengthening and the elasticity therapies. That's your therapeutic protocol. That is why you should be doing the therapies you should be doing and when you should be doing them. And all of it is based on you finding them, doing the right test, doing sensitivity testing, relevance testing, doing hybrid test, understanding the difference between a hybrid, objective, and subjective test. But that's what it's based on. That's what you should. How you explain what you do. That's why you do what you do. So the common symptoms in the chiropractic office: pain and inflammation, muscle spasms, restricted motion, and active, passive, and joint. Sometimes you can have tingling or numbness or loss of strength or loss of elasticity. Those are the common symptoms that you'll see in the low impact. So what are some common pain therapies? So you should have your common pain therapies: E-stim, chiropractic physical medicine, interferential current, laser therapy, massage, passive range of motion, reciprocal inhibition, ENF traction. And you should be able to explain very simply on an 8th grade level how that therapy physiologically is doing what you want it to do. Decrease pain or decrease inflammation or decrease muscle spasms. You should be able to explain very simply. I was amazed how many doctors are doing therapies. And I'll say, how does it work? I don't know. That doctor, they'll buy a laser machine. I'm going, how does it work? I don't know. And here's my response. How would you like it if your mom went to the doctor and gave her medication, he didn't know why to take the medication? How would you like that? That's what you're doing. Know the basics of what your therapy does physiologically. Physiology. What does your therapy do? And what is it trying to affect? Is it trying to affect inflammation, pain, muscle spasm? How does it affect it? How? Is it the gate theory? Is it the piezoelectric effect? What is it? You should know that. So these are the common pain therapies in chiropractic. And then you have the inflammation therapies: muscle stim, passive motion, laser massage, interson. I can explain every one of these. And you can have therapies, as an example, muscle stim. I can explain how I can use muscle stim only for pain. I can explain how to use muscle stim only to decrease inflammation. I can explain how to use muscle stim to increase active range of motion. I can explain how to use muscle stim to increase elasticity. I can do that in my therapeutic protocol. You need to be able to do that. Why are you doing the therapies you're doing? What are the effects that they have? If you're not, you shouldn't be doing the therapies. And here's one of the common things I hear in chiropractors. I don't know, I went to a seminar and they said I get reimbursed for it. You're in trouble. You're in trouble. So, inflammation. So, depending on the therapy, can you explain how chiropractic can help with the pain? Can you, to an 8th grade educated audience? Can you explain how the chiropractic physical adjustment? Can you explain how it helps with muscle spasms? Can you explain how it helps with active, passive, or joint motion? Can you do that? You need to be able to do it or you shouldn't be using the therapy. And that's what your therapeutic protocol is based on. It's based on your biomarkers. Okay? So you can use one therapy that affects in many ways. It's just used maybe differently, that's all. Okay? Muscle spasm therapies, chiropractic physical medicine, muscle stim, massage, reciprocal inhibition, PNF, trigger point therapy. Restricted motion therapies, chiropractic physical medicine, intersegmental traction, massage, reciprocal inhibition, PNF traction. Loss of strength, resistive therapy bands, active resistance. Loss of elasticity, chiropractic physical medicine, intersegmental traction, reciprocal inhibition, PNR, massage traction. Those are the absolute most common. Here you go. Here you go, right up here. You see those symptoms? Those are the most common personal injury symptoms. You see those are the most common pain therapies. Those are the most common inflammation therapies. Those are the most common muscle spasm therapies, chiropractic. Those are the most common restricted motion therapies. Those are the most common loss of strength therapies. Those are the most common loss of elasticity therapies. You get my point? Okay? Now that doesn't mean you do all of them, but you should have in your office a protocol for pain and inflammation and muscle spasm. What therapies or what do you do for that? Because that's what you're going to see. You should have a protocol for the repair phase, active, passive, and joint motion. What's your protocol for that? You should have a protocol for increasing strength and elasticity. What are your therapies or what's your protocol for that?